Very good evening, everyone. So, I hope everyone is doing very well and hope your preparations are going very well. So, those who are preparing, June is not so far. Give your best. Try to study for 8 to 10 hours daily and don't get disheartened or demotivated. There is always up and down, as said by Ratan Tata. If there is no up and down in your life, there will be a flat ECG that leads to dead. Okay, so we should be alive, and we as a FMG should always try to focus on our goal, that is FMG June 2023 exam. So today topic for me is that so many people have cleared the exam this time, January exam this time, and they are sitting idly. So for me, best solution for them is that how they can utilize their time and how they can make use of his time by doing observationship in India. So today topic is that only. So I will just help you in few points whether how you can approach and how you will be doing and where I am doing and how I applied and how I got. I will be revealing that. Okay. So let's start. Main thing is that all the FMG, those who have cleared in your state, whichever state you are in, you can easily approach to nearby your hospitals. Okay, it may be like super specialty or normal or not so big. You can just visit and meet the owner or any HOD of the department. You can just go and tell about that you want to observe something. And many hospitals in India, they are offering also, like Apollo, Max and all, they are allowing also, no problem in that. The main purpose for observationship in India is that to give you guideline how the things work in India. For example, now as FMG we only study the theories and we lack little bit of knowledge about how system work in India and how as MO you are going to work in hospital. Okay, for that you need a clear concept regarding it. So first step is that first you go to hospital owner or any HOD of that department. You can just request it, and there are so many options. Like for example, if one hospital is not allowing, it's okay. Go to another one. Try to find out and convince out of 3 4 hospitals, anyone will accept you, and they will teach you how to do everything. For example, in observership in India, what all you can do is that you have to observe the patient. You won't be treating anything. You won't be doing any procedures. You just have to see how doctors are performing their duties and how you can also perform later on when you get your license. Okay, so when you go inside the hospital and for example there are many varieties of department in hospital. For example, if I talk about my department, whether I am doing observationship, is that is in nephrology. Okay, nephrology is generally deal with people kidney and their health management and the people with CKD in dialysis. Okay, so I got very lucky to know all this about observationship, is that you will come to know how everything is working and how everything is working smoothly and what as a doctor you can play a major role in that situation. For example, in nephrology, many people nowadays are hypertension and diabetes. Okay, and as far as CKD is concerned, DM is very much responsible for this. Okay, so you have to just observe how this dialysis is taking place, how the CKD patients are behaving, and how the CKD patient, what all complications are coming, and what all you can do for that management of the complication. You just have to see and just write down in your notebook. Okay, and in case you, if you don't understand anything, you can ask any doctor or consultant. They will help you surely, and there is no one that will deny if you ask any help. So okay, if one person will not help, it doesn't matter, go to another one. It's not like this. You have to, if you want to learn something, you have to be very like straightforward. Okay, and when you start learning something, so you have to come forward only, because no one will come and teach you. You have to come forward and try to request everyone to teach something what they are knowing regarding their field. So according to me, I am doing observationship in nephrology department. Okay, and in this my work is that first I have to go see the patient, those who are in dialysis. Okay, if they are in dialysis, so I have to just ask them how they are doing, what all they are going through, and what all means you can see the edema, you can see so many clinical features over there. So in coming videos, I will all explain the all explain everything about CKD, nephrology, and what all the things which are related with dialysis. I will be informing that. The main thing is that first go to any hospital, join any department, and start learning from them. Okay, they will teach you, boss. No need to take tension about that. Teaching, they will teach you. Okay, whatever you will ask, but you should be like very active in asking question. If you don't ask question, they will not they will not teach you anything. Okay, for me, I like to question so many question to my SRs, and even JRs, and even consultants sometimes, whatever I feel any doubt, because we FMGs lack practical knowledge, right? So we should focus on how to learn practical things. So as far as my observationship is concerned, I am like doing well. I visited a hospital nearby my house, and I used to go there and sit down and proper, like morning to evening I am observing. This is my like I love to go to hospital, and in term of learning thing, I used to go to 10 o'clock and come back at 6 o'clock. Okay, and I used to observe everything, whatever is happening, how to take down notes, how to take out BP, how to take out all the necessary medication which are been given during complications, and this all is helping and increasing my knowledge. Okay, so you people also can go nearby your hospital and try to get something, because your passing certificate will take time around last passing certificate till April they are going to distribute. So what, why to sit down at home? You are already passed the exam. Be confident, go to hospital and try to explain what you are going through and what you are going to learn. Okay, that's this all everything about observationship in India is very easy. You can also search on Google also which hospital is providing, whether it is paid or is free. So according to me, it's every time maximum of the hospital is free only. No need to pay anything for observationship. They will also not pay you, of course. They are giving the knowledge. They will not pay you. Simple. So this is for your benefit. Go and get the knowledge and try to enhance your knowledge, practical knowledge. And only one thing, doctors, you have to be very focused on your skills, because ultimately you will be treating patient, right? And if you don't know the diagnosis and treatment, then you won't be able to treat anyone. So my suggestion is that go and join the hospital and try to ask maximum question whatever doubt you have. Okay, don't be shy, because if you feel shy, you won't learn anything in life. Okay, so this side signing off, Dr. Nadeem. Thank you so much for listening me. If you like my videos and if it is informative, you can share also to other FMGs who are struggling now and who have passed the examination. And the next video I'll be making about how to join any state medical council for provisional registration. Okay, so provisional registration is very much required for doing internship in India. So see you in next video. Thank you so much. God bless you everyone.